appreciate everybody coming together. These are different times. We've never seen anything like this in our lifetime, and we won't see it again. But we're going to live through what we got. And my main purpose here today is to try to help everybody understand how to better protect ourselves. So everybody's spread out, and that's a good thing. The governor, as we know, issued a stay-at-home order, but construction industry was deemed essential. So here we are. And I appreciate you coming to work, and we're going to do all we can to keep everybody healthy. I'm not a medical professional, so what I'm saying here is not medical advice based on the research that we've done. If you follow 2 simple rules, your odds of staying healthy are much better. The rules are simple, but completely following them is not easy. It's going to take a conscious effort and a sense of awareness of what to do. So the first rule, we know what that is: social distancing, 6 feet apart. Your arms are 3 feet long, stay arm's length away. That's 6 feet. And this rule gets most of the attention, and the reason for that rule is primarily if somebody sneezes or coughs, the virus gets on moisture droplets that goes through the air, you can breathe them. From what we can tell, just normal respiration is not going to pass the disease along, but if somebody sneezes, then the moisture droplets can get in the air and they can be inhaled. And so you might be infected by somebody else, but you might infect somebody yourself. You may have picked up the virus and you don't know it. Most people that have the virus develop symptoms within 1 to 3 days of their initial infection. Some people might go longer. We don't know. And so you don't know. I don't know if I'm carrying the virus right now. I wouldn't know that for 2 or 3 days. If I picked it up this morning, I wouldn't know that. And so you need to be aware that the social distancing works both ways. You might think you're fine, you might not be. So you need to be aware of that, because nobody wants to spread this virus to friends or family. So that's rule number 1, keep your distance. The second is keep your unsanitized hands from your face. That is, from your eyes, your nose, and your mouth. Dr. David Price, Weill Cornell Medical Center, somebody who's in the front lines of fighting this. He's in Manhattan. Did a video, it's an hour long. You can find it, you can watch it. But he says that in his clinical opinion, nearly all transmissions come from people picking up the virus on their hands and then touching their face. Specifically, your mouth, your nose, your eyes. I mean, we're rubbing our faces, eyes, nose, all the time. And he says that's the best way for the virus to get into your body. The research isn't complete on any of this stuff, but we believe, doctors believe, that the virus can live on the surface, say a piece of steel like this, for 3 days. Might live on cloth or cardboard for a day. Maybe it's 2 or 3 hours. We don't really know. But you have to imagine that when you touch a doorknob, you don't know if the person before you wiped their nose and touched the doorknob and the virus is on there or not. So, same thing if it's a pipe wrench or a tape measure or a pair of shears that somebody else has used, the virus could be on that surface. So you need to remember that. So there's 2 things that you can do that we're going to try to help you do to try to keep you from doing the hands to face. Number 1, wear gloves and safety glasses. I can't rub my eyes with the safety glasses on. And odds are, if I'm wearing gloves, I'm probably not going to wipe my nose or my face. So the gloves help to remind you not to touch your face. The virus could live on the surface of these gloves. We don't know for how long, but we know it can. So if I were to touch the table and wipe my mouth, the virus could come in that way. So the gloves are there primarily to help you remember not to go hands to face. So the second thing is, if you're not wearing gloves, sanitize your hands. I mean, I've just got to rub this nose. I've just got to. So, wait a minute. Hand sanitizer. I've got about 50 bottles of it here. I don't know if my hands are clean or not. They've been inside those gloves. They might have been infected when I put them on. When I was taking the gloves off, I touched the outside of the gloves. Hand sanitizer. Okay, I'm good. Sort of a pain to go through that, but I'm good. Uh-oh. Now I'm not. So whenever you touch a surface, keep your hands sanitized, you're good. So that's a lot of aggravation, but if you can remember to not touch your face, then your odds are a whole lot better. Okay, so I got sanitized hands, I'm putting the gloves on, I'm touching the outside of the gloves, so I don't know if my hands are still sanitized or not. Just remember that when you take your gloves off. Now, it's okay if the virus gets on your hands. The skin is actually a very good barrier against any kind of disease, any kind of virus. It's not going to go through your skin. Now, if you have a cut on your finger, I don't know, maybe it goes in through that cut. So if you got a cut on your fingers, put some antibiotic on there, some Neosporin, and put a Band-Aid on there. Don't take that chance. So as long as your hands are safe and you don't touch your, if you don't have a cut in your hands and you don't touch your face, you can carry it around on your hands. Just remember, the object is not to touch your face. So I've got hand sanitizer, and everybody can come up and get a bottle of that. Hopefully you have gloves. We've got about 500 pair of these gloves on order, and hopefully they'll be in tomorrow. It's interesting, you order stuff these days and you think you're going to get it, and then the day before it gets back ordered, but we think we're going to get those. The hand sanitizer is actually because we can't get all we need. The alcohol comes from the local distillery there in Newport News. I've forgotten the name of it. And then we've mixed it with some aloe. Ironclad, yeah. So we mixed it with some aloe and some hand soap in there to try to sort of make it a little bit more usable. Okay. So you're able to keep this in your pocket. We keep disinfectant around here. Wipe surfaces down as much as you can. Again, as long as you remember that the best way for this virus to be transmitted is from a surface to a hand to your face. We can keep surfaces clean, we can keep hands sanitized, and we can remind ourselves not to touch our faces. Your eyes are actually pretty good about not picking up this disease. Now, some people wonder about face masks. This simple cotton face mask or a bandana, probably not going to do anything as far as breathing in or out. If you sneeze, it might keep it from going further away. But the main thing about a face mask, and if we can get them, we are, the simple cotton face mask. The NH95 masks, they need to be in a hospital for people that really need them. But if you wear a face mask, it keeps you from touching your nose or your mouth. So if we can get those, we're going to hand those out too. So for now, rule 1, social distance, we all got that. Number 2, and this, you just really have to think about this, it's a hand-to-mouth thing. And it doesn't just apply here at work, it applies at home. It's probably harder at home. Nobody wants to wear these around the house. And you want to think that your roommates, or your wife, or your kids are all healthy. You want to think that, but you don't know. You don't know. And so places where you touch surfaces, kitchens, keep sanitized. Bathrooms. If it's two of you in the house and you and your wife generally use the same bathroom, but you got a spare kid's bathroom, just go ahead and split up. Let's get through this for the next couple of months. I don't know how long it's going to take, but just think about where the virus, you have to, anytime you look at any surface, you have to think that virus could be on there. So keep your hands sanitized, keep your distance, and that is the best way to protect yourself. So let's all come up here one at a time, and let's get a bottle of hand sanitizer. You can cut that now.
Yeah.